Studies show 50% of those who are sexually active will get an STD by the time. The Florida Department of Health in Polk County has all of the details about the reality of STDs in Polk County and what we can do to reduce this trend, coming up on Polk Place. Thank you for joining Polk Place. I'm Nicole Riley, your host, and joining us today is Dr. Joy Jackson with the Florida Department of Health in Polk County. Thanks for joining us today, Dr. Jackson.
Thank you. Glad to be here.
Now, I understand that you're here to talk to us a little bit today about National STD Awareness Month. Can you tell us a little bit about that?
Sure. This is a month in the year that we encourage individuals, healthcare providers, and communities to be aware of what's going on in their communities regarding sexually transmitted diseases, otherwise known as STDs. This is a growing problem across the nation, not only in the nation, but Florida and Polk County. And there's some simple messaging that we've got to remind people to protect their own sexual health. That includes talking to sexual partners, being tested for STDs when appropriate, and receiving treatment.
April being STD Awareness Month, can you tell us a little bit about the reality of STDs here in Polk County?
Yes, in the year of 2015, there were over 4,000 individuals who were diagnosed and treated with a bacterial STD. And bacterial STDs that we're speaking about are gonorrhea, chlamydia, and syphilis. And the disturbing thing is that in Polk County, about 67% of individuals that are diagnosed and treated are youth between the ages of 15 and 24. And this is a great higher percentage than what we see nationally and in the state. Nationally, about 50% of diagnoses occur in this age group, and in Florida, about 60%. In Polk is right around 65%.
That seems really high for a county, especially of this size. Now, you've mentioned the bacterial STD rates in Polk County. What are some of the common types of STDs that you all look out for?
Well, we look out for the bacterial STDs that I mentioned, gonorrhea, chlamydia, and syphilis. Those are the ones that are screened very regularly. Other types of conditions that can be sexually transmitted are obviously HIV, herpes, and human papillomavirus is one that we want to talk about a little bit because there is a vaccine to prevent HPV. And this basically is a vaccine to prevent cancer. And it's very important that we encourage youth between the ages of 11 and 12, males and females, to be vaccinated against HPV. And while I'm speaking of it, I will go ahead and say that HPV is a very common infection, and it's estimated that 1 out of 4 Americans has HPV. Now, obviously, the vast majority will not go on and develop problems, but there are certain strains that can lead to cancers of the genital tract. And it's the HPV vaccine that can help prevent that, and is very important.
So is the screening for HPV and these other types of STDs, is that done in a routine checkup, or does it have to be requested from a healthcare provider?
Well, the best approach to HPV is prevention, which is with the vaccine, but there are guidelines in women having pap smears that they can be tested for HPV by pap smear. And any particular type of lesion of the male genital area can also be tested. But once an HPV infection becomes established, then basically it becomes screening for things like cancers or genital warts. So that the best message and the best thing to do is to really prevent HPV by vaccination in our young people.
Now, what about screening for other types of STDs? Is that something that someone could go to the doctor for? Is that done routinely as well?
Right, yes, absolutely. And the STDs that we test for very regularly in the health department are chlamydia, gonorrhea, and syphilis, and as well as HIV. Each of these is tested a little bit differently, sometimes with a swab, sometimes with a urine specimen or a blood test. But there are guidelines for when individuals should be screened. And we encourage individuals to speak with their healthcare provider about screening. But a big message here is that if someone is symptomatic, with pain with urination or discharge, it's good that they be seen and evaluated by a provider for testing and treatment. Some individuals may not want to go to their regular provider for these discussions. These are very intimate, very private discussions. And if they're uncomfortable, there are other places in the community to go for testing, screening, and treatment. And the Department of Health is one of those.
What are some of the ways that we can encourage individuals to prevent the spreading of these STDs?
Well, first of all, we really encourage individuals to speak to sexual partners. And, obviously the only way to totally prevent an STD is to not have intercourse, not to have sex. But that's a very personal decision and one that I have no judgment over. That's an individual's decision as to when and whom they have sex with. But my job is to educate and inform and encourage those who are considering a sexual relationship that the two of you actually talk about it and consider being tested before you have sex. Because, risk factors for STDs tend to be multiple sexual partners. But even if you've had one, if that person has had multiple, you're exposed to everyone they've had sex with. So to talk about it, to plan, and to be tested for prevention is extremely important. It's also very important for condom use. Condoms, latex condoms properly used will prevent STDs.
Now, is that something that's accessible at the health department as well?
Absolutely. Obviously, condoms can be purchased in multiple locations, but the health department has them for free. We have them available at all of our clinic locations, and also we do a significant amount of outreach in the community, and we provide condoms in many community areas. And if anyone has questions about where they can get condoms for free, they can call the Department of Health.
So April is STD Awareness Month. It's a time to educate individuals, educate the community. Tell me a little bit about why it's important to educate individuals and bring awareness to STDs.
I think it's important so that everybody is aware of what the risk factors, so they can assess their own risk. So education is important. It also encourages individuals to be screened if they're in a category needing to be screened, and tested and treated, because this is how we prevent spread of STDs. And it's very important to be on top of this because of the risk of sexually transmitted disease to individuals, and in the case of women to fetuses when they become pregnant. We know that gonorrhea and chlamydia in males can cause urethritis, sometimes epididymitis, but in women it can lead to pelvic inflammatory disease, which can be quite serious and life-threatening. It can lead to infertility. If they become pregnant, it can lead to premature deliveries, low birth weight, and if a baby is born into a setting where there is GC or chlamydia or syphilis, it can lead to bad outcomes in the baby. Now, there are certainly guidelines for testing and evaluating all pregnant women, and that is done routinely in all pregnancies, but there still is a risk to that woman and to her unborn baby, or once the baby is born.
I know you mentioned earlier that approximately 67% of those who have STDs in Polk County are among the ranges of 15 to 24 years old. That seems really young. Are there things that the health department's doing or individuals in the county are doing to address this issue, Polk?
Yes, the Department of Health has an STD work group, and we are working within our agency to increase access for individuals who may have symptoms of an STD. We also have disease intervention specialists who work in the community to increase awareness and to contact those who may have been exposed to an STD. We also work closely with community partners such as Healthy Start Coalition and the Teen Pregnancy Prevention Alliance, and there is a teen summit coming up in May. And information about that can be reached on the Healthy Start website. And this is a good opportunity for teens and their parents who wish to go with them to learn about teen pregnancy prevention and STDs and other preventive messages. We are very interested in the Department of Health if there are any agencies or organizations that work with youth, that we are happy to partner with them to help increase education information to their constituents, and we would encourage them to reach out to us at the Department of Health.
So for those people who do want to get involved or are interested in learning more about the Teen Summit or getting involved with the health department, where can they, who can they contact and where could they get involved?
Well, they can contact the Department of Health and through our communications office or through our website, as well as Healthy Start's website will have invaluable information.
Dr. Jackson, is there anything else you would like to share with us today about STD Awareness Month or the reality of STDs in Polk?
Well, I think the reality is that STDs are with us. Over 4,000 people last year were diagnosed. That means that there are probably many, many more out there that did not seek health care that have STDs. We encourage individuals to be aware of their status and to be tested if they've had multiple sexual partners or a new sexual partner, because treatment can help prevent complications of STDs. I also want to reinforce the absolute importance of HPV vaccines in our young people.
Well, thank you so much for coming here today, Dr. Jackson, to share with us a little bit about STD Awareness Month and all the valuable information you've provided us.
Thank you for the opportunity.
National Sexually Transmitted Diseases, or STD Awareness Month, is recognized each year in April as an opportunity for individuals, doctors, and communities to address ways to prevent STDs. Unfortunately, the rates of STDs have been trending upwards over the past few years in Florida and in Polk County. The Florida Department of Health in Polk County wants to bring awareness about the reality of STDs in Polk and what we can do to reduce the trend. For more information, give them a call at 863-519-7900, or for more information regarding STD testing and treatment services at the Florida Department of Health in Polk County, visit the website at www.mypolkhealth.org. For more information about the Polk's STD awareness campaign for youth, visit www.healthystarthhp.org/events.